noting that I'm a medical oncologist and not a urologist. So while I work very closely with my urologist at City of Hope, I'm certainly not the one who would be performing your surgery. Having said that, there are a number of considerations that both teams face in terms of whether or not to provide specific surgical options to patients with newly diagnosed kidney cancer. The first decision that one must face is whether or not to use an open approach or a laparoscopic approach or a robotic approach. I put the latter two in one category. The open approach makes a relatively large incision in order to remove a kidney mass. The laparoscopic or robotic approach relies on relatively small ports or small incisions that the surgeon makes in order to remove the tumor. The main benefit, I would say, of the latter approach is that it really typically entails a shorter recovery time. Patients typically experience less postoperative pain after laparoscopic or the so-called minimally invasive procedures versus an open procedure where a larger incision is made. Having said that, the decision to use these minimally invasive techniques is somewhat nuanced. It really depends on the size of the tumor. As an example, I had a patient in my clinic 3 or 4 weeks ago who had a 26-centimeter tumor that was just not amenable to a minimally invasive approach and had to be removed through an open technique. So this is a decision that should really be made in concert with your surgeon, facing some of those practical questions. The second consideration that one might face in kidney surgery for kidney cancer is whether or not to use partial nephrectomy. And when I refer to nephrectomy, I'm referring to removal of the kidney itself or a portion of the kidney, or a radical nephrectomy, which is the removal of the kidney in its entirety. And there's been a lot of debate around whether or not to use one procedure or the other. The perceived benefit of using a partial nephrectomy is that you may actually preserve more kidney function. Again, if a patient has a small tumor that's confined to only a portion of the kidney, if we remove just a portion of the kidney, the remainder of the kidney may still function in its normal role of clearing the bloodstream and producing urine. On the other hand, of course, if we remove the kidney in its entirety, the kidney function more globally may be more compromised. What I will say is that there's been some literature presented recently, and this was a randomized trial that was conducted in Europe, where partial nephrectomy was compared to radical nephrectomy, and the results in terms of preserving kidney function were more debatable. At this point in time, there are some efforts being looked at now to, again, reassess these studies and perhaps even repeat these studies to really clarify in which settings one should receive a partial or radical nephrectomy. For the time being, I would really recommend engaging your surgeon in a discussion regarding the benefits of each technique and what approach may be favored in your specific setting. It really does require some degree of personalization.